Now, the second nuclei present in the hypothalamus is the posterior hypothalamic nuclei. These neurons are activated when we are exposed in colder environments, and when they are activated, they will now initiate temperature conserving mechanisms. So receptors from the skin, when they detect temperature, depending on which receptor, warm receptors will basically send signals going to your heat-sensitive neurons, activating the anterior hypothalamic nuclei, activating now sweat and vasodilation. When cold receptors are activated, these signals are sent to the posterior hypothalamic nuclei, initiating now temperature conserving mechanisms, resulting to shivering and vasoconstriction. Now, the posterior hypothalamic nuclei summates central and peripheral signals. Now, the two nuclei, the posterior and the posterior preoptic and anterior hypothalamic regions, do not work independently. They communicate with one another or coordinate with one another in order to integrate central and peripheral thermal signals. So, the body will now act appropriately depending on the temperature. So if you look at the diagram, when head temperature or body temperature is decreased, so this is detected by the posterior hypothalamic nuclei. So this will now initiate heat production. So that will result to continuous vasoconstriction, piloerection, increased shivering, and thyroxine release. So that will basically bring the core temperature back to normal. However, when body temperature or head temperature is increased, you will note that evaporative heat loss is increased. So this is due to the activation of the posterior preoptic and anterior hypothalamic nuclei. So once they are activated, heat-losing mechanisms is initiated. So vasodilation occurs, increased sweating, and decreased chemical and mechanical thermogenesis. So how does mechanical thermogenesis or shivering happen? So when we are exposed to colder temperatures, this is detected by the posterior hypothalamic nuclei. So the dorsal medial portion is said to be the primary motor center for shivering. So once we are exposed to colder environments, signals are sent down to the spinal cord, increasing facilitation of the anterior motor neurons. That increases the tone of the skeletal muscles, resulting to feedback oscillation of the muscle spindle stretch reflex. So this will now result to shivering of the muscles. Now the dorsomedial portion of the posterior hypothalamus will be inhibited by the anterior hypothalamic preoptic regions, and of course stimulated by cold signals coming from the skin or the spinal cord. Now, two important factors will regulate chemical thermogenesis. First, we have the sympathetic activity, and second, we have our thyroid hormone. Now, for sympathetic stimulation, it also regulates basal metabolic rate of the body. One important substance is thermogenin. Now, thermogenin is present in the mitochondria of brown fats, particularly in infants. Thermogenin is responsible for uncoupled oxidative phosphorylation. When thermogenin is activated, instead of producing adenosine triphosphate, thermogenin directly produces heat instead of ATP. Thus, if you will observe, infants do not readily shiver or sweat because their hypothalamus is not yet matured. So what regulates their body temperature is basically thermogenin. Now for our thyroid hormone, this is responsible for term cause of heat production. Now, when the anterior hypothalamic preoptic regions are cooled, or when we are exposed to colder environments, this will increase TRH, TSH, and thyroxine output. Now let's talk about the feedback gain of temperature control. Take note that the body needs to maintain a core temperature of around 37.1. So when we talk about feedback gain, this measures the effectiveness of a particular control system. So looking at the body's ability to regulate body temperature, it is said that for every 28-degree change in environmental temperature, core temperature changes by 1 degree. So looking at the formula, change in environmental temperature divided by change in core temperature minus 1. The feedback gain of our thermoregulatory mechanism is around 27. Now, the higher the value of the feedback gain is, the more effective or the more efficient the control mechanism becomes. Now let's look at the set point for temperature control. So firstly, let's look at sweating. So sweating happens when we are exposed to warmer temperatures. So in this diagram, you need to take note of three things. First, you have the set point, the threshold for sweating, and of course, skin temperature. It is said that when skin temperature increases, the set point decreases. So if you look at the diagram, with skin temperature at around 32 degrees Celsius, the set point is set to around 36.9 degrees Celsius, or a little higher than 36.8. So that's the set point. However, if skin temperature is increased to 39 degrees Celsius, notice that the set point decreases to around 36.7. Secondly, when skin temperature is increased, the threshold for sweating begins at a lower hypothalamic temperature. So again, take note of skin temperature around 32 degrees Celsius. Now, the threshold for sweating is depicted by the black vertical lines. So the threshold for sweating is around 37.1. So this means that when head temperature is at 37.1, sweating begins. If you increase skin temperature to around 39 degrees Celsius, notice that the threshold for sweating decreases at a lower hypothalamic temperature. So at 39 degrees Celsius, the threshold for sweating begins now at around 36.8. So it is said that at greater skin temperatures, the hypothalamic set point goes down. This is also true for shivering. So if you look at the diagram, again, take note of three things. First, you have the hypothalamic set point, the threshold for shivering, and thirdly, skin temperature. When skin temperature goes down, shivering begins at a normal or a higher hypothalamic temperature. So looking at our skin temperature from 24 degrees to 22 to 20, take note that at 24 degrees Celsius, the hypothalamic set point is lower, and as skin temperature further decreases from 24 to 20 degrees, the hypothalamic set point increases. So they are inversely related. Now talking about the threshold for shivering, this is depicted by the black vertical lines. So again, at 24 degrees Celsius, take note that the threshold for shivering is around 36.6 degrees Celsius. Meaning to say, if our body temperature is around 36.6, then we'll start to shiver. When body temperature further decreases, so it goes down to, let's say, 20 degrees Celsius, take note that the threshold for shivering increases. This is also inversely related. So at 20 degrees Celsius, take note that the threshold for shivering now starts at 36.9 degrees Celsius. So other than the central nervous system regulating our body temperature, we also have local skin temperature reflexes, such that when receptors present in the skin are activated, appropriate responses will be elicited. So for example, when you place an ice pack at a particular limb, then vasoconstriction happens in that area. Or if you place a warm object on a particular area in the skin, then sweating and vasodilation also happens. So this is facilitated by cord reflexes. When the spinal cord is transected, control from the higher center will no longer go to the periphery below the transected regions. So hypothalamic control is lost. However, cord reflexes will remain intact. This is, however, a weak mode of temperature regulation. So we will only be observing local vasoconstriction or vasodilation processes. Signals coming from the hypothalamus will no longer reach the regions affected by the transected cord. So with that, temperature regulation becomes weak. So only psychic responses to temperature sensation in the heads will indicate or will upraise the central nervous system if the body is exposed to high or low temperatures. So we've been talking about how the hypothalamus and the spinal cord regulates our core temperature. These are actually weak mechanisms in maintaining our core temperature. What is more important is our behavioral response to environmental temperatures. For example, when we are exposed to warmer environments, we prefer to wear minimal clothing and go to the beach. In colder environments, we want to wear thicker clothing and sit right next to the fire. So these behavioral responses are actually more important in maintaining or controlling our body temperature compared to central and peripheral regulation. Now let's look at temperature with respect to the clinical setting. Now when we talk of fever, take note that the normal body temperature is around 36.5 to 37.4. If body temperature exceeds 37.4 degrees Celsius, then this is termed as fever. Now, it doesn't necessarily mean that when body temperature increases, we have fever or there's a pathologic cause for an increase in fever. Sometimes body temperature can increase physiologically. For example, when we engage in strenuous exercise, basal metabolic rate increases, thus increasing our body temperature beyond 37.4. Now, pathologically, fever is being produced, or this is due to pyrogens. So pyrogens are substances produced by certain bacteria. So these may be your exo or endotoxins. Fever can also be elicited by interleukin 1 and prostaglandin E2. So these are your cytokines. Now, certain drugs can either decrease interleukin 1 production or prostaglandin E2 synthesis. So these drugs or your antipyretic drugs can easily decrease fever. Now, other causes of fever, of course, you have surgery and CNS tumors. If you look at the diagram on your right, take note of the red line. Now, the red line will depict body temperature, and the dotted blue lines will depict your hypothalamic set point. Now, whatever the set point is, it is the job of the body to match that set point. For example, when pyrogens or interleukin 1 or prostaglandins are present, then this will increase the hypothalamic set point. So with that, the body must find ways in order to match the set point. Thus, heat production increases in order to match the higher set point. So take note that temperature increases, or the red line or the red graph increases, matching the set point. So if the red line is higher than normal, then this is fever. Now, chills happen when the body temperature is less than your hypothalamic set point. So when the set point is high, the body must find ways in order to match that set point. Thus, there is a sensation of cold when we experience chills, so the body shivers. When the body shivers, this is mechanical thermogenesis. This is a way by which the body tries to bring the temperature up, matching the hypothalamic set point. Now, during convalescent period or during recovery, when pyrogens and your cytokines will decrease, so your set point now will go down back to normal. However, since body temperature is still high or the patient still has fever, the body now must find ways in order to match the lower hypothalamic set point. So this is termed crisis. So what happens is that when the hypothalamic set point is low, but body temperature is still high, the body must find ways in order to match the set point. In other words, the body must find ways to lose heat. So this is when crisis would occur. What would happen is that vasodilation and sweating is observed. So with vasodilation and sweating, heat loss is increased, and take note of the red line. So body temperature gradually goes down to match the lower hypothalamic set point back to normal. Another important response of our body to tolerate hot environments is acclimatization to heat. So again, this happens when RAAS is activated and aldosterone is released. So when we are acclimatized to heat, we increase our tolerance to hot, humid conditions. So acclimatization happens around 1 to 3 weeks exposure to warmer environments. So this is particularly observed among workers who are always under the sun. So sweating increases. So with the action of aldosterone, so that maintains effective circulating volume. So there is decreased loss of sodium and chloride. However, more potassium is lost from the body. So this is important to take note when we are exposed to hot environments for longer periods of time. Electrolyte replacement is essential. So another important clinical condition is heat stroke. So heat stroke happens when we are exposed to hot environments for prolonged periods of time and we are not acclimatized to heat. So when heat stroke sets in, body temperature increases and the body's ability to regulate temperature is lost. So with an increase in temperature, damage to neurons would set in. So with that, symptomatology of heat stroke is primarily neural in nature. So you have confusion, weakness, lethargy, etc. Now, heat stroke is a potentially fatal condition. So this is an emergency. So what could happen is that blood vessels would dilate. They are not able to respond to the hypothalamic control, and circulatory shock will occur. So this is potentially fatal. Now, in managing heat stroke, it is important that we bring temperature back down to normal. So we apply cold compress, submerge the patient in cold water bath. So of course, in preventing heat stroke, we need to be acclimatized to heat, and we need to regularly control our temperature by drinking lots of fluid. Now let's talk about exposure to extreme cold. So first you have hypothermia. So hypothermia happens when core temperature drops to less than 25 degrees Celsius. So this usually happens when we are immersed in ice water for prolonged periods of time. Now, one of the complications of hypothermia is, of course, cardiac standstill and fibrillation. So when body temperature drops to less than 29 degrees Celsius, the hypothalamic regulation for temperature is lost. So there's a decrease in chemical heat production for every 12-degree drop in body temperature. So CNS activity goes down. So you will observe weakness, loss of consciousness, and of course, you decrease thermoregulatory mechanisms. Now, frostbite happens when water inside the cell freezes. So this is particularly observed in the digits of our fingers or the toes, or in the earlobes, or in the nose. So this happens when we are exposed to very, very cold environmental temperatures. So what happens is that water inside the cell would freeze, blood vessels would constrict, so blood flow going to these regions will decrease, the cells would die, and necrosis would set in. Now, there is a phenomenon called cold-induced vasodilation. So what happens is that when blood vessels are exposed to colder environments, they won't be able to contract properly. So with that, blood vessels will remain patent. So blood is delivered to colder regions of the body. So this will now conduct warmer core temperatures going to the skin. So this actually prevents frostbite. So this is a protective mechanism. Another thing to take note of is your artificial hypothermia. So this happens when temperature is lower than 32 degrees Celsius. So what happens is that the metabolism of cells would decrease. Now, artificial hypothermia is actually clinically done when we need to decrease the metabolism of a particular organ, let's say during organ transplant. So when a particular organ is placed in an ice pack, the cold temperature would decrease its metabolism, increasing now its viability. Now, this can also be done with the body, theoretically, and this is done with sedatives. Thank you for listening.